So if you have read and understood, considering this communication skill session, can we begin?
Hello.
Hello.
Yeah, my name is Dr. Ali. I'm a part of the surgical team here. And can I confirm your name in relation to the child, please?
I'm Elise. I'm her mother.
Okay, and can I confirm your name, please?
My name is Elise, doctor.
Okay, I'm here. I was told to talk to you about your child's condition. But before we discuss that, I would like to ask you, what do you know so far about your child?
I don't know, doctor. Like I was at work, and then I got a call from the hospital saying that my daughter has been brought to this hospital, brought to the hospital, and I was told that she need to undergo surgery or something. I'm not sure, doctor.
Yes, that's right.
I'm really worried.
Yes, I understand your concern. You must be very anxious because you're a mother, and not seeing your child in this must be very stressful for you. So your child was brought to the hospital by his school teacher, and she had tummy pain. We did some investigations and we examined your child, and it seems that she's having a condition that's called appendicitis.
Oh, what is it, doctor? What?
Yes, it's nothing to be afraid of. Of course, your child has tummy pain, and it is because of a condition in a tummy. This is an organ that can get inflamed quite often in young children and adults. And this is something that needs to be treated with surgery. And this is exactly why I'm here. I'm here to discuss about the possibility of surgery and the complications and procedure and all that.
Doctor, you are saying I need not worry, and again you are saying that she need to undergo surgery. So I'm quite confused, doctor. Are you sure that she's having this thing you're saying as appendicitis? Are you sure that she's having
we
this?
Have. Yes, I understand. We have done initial assessment, and up to this point, it is pointing in the direction of appendicitis. We will further confirm, and with the investigations, and then we are going to treat it with the surgery. Our consultant will come, and he will further decide about the surgery. And yes, would you like to know about the procedure and the complications?
Doctor, you are saying that you need to further confirm. So does it mean that you are not sure that she has this appendicitis?
We are sure, but even if we are sure, we need to run the confirmatory test because we do not want to take anything for chance. A lot of things can be confirmed on. Yes, sorry.
And what would that test be?
Yes, we will do an ultrasound, and only after surgery, the removal of the organ, that is the appendix, when seen under microscope, will confirm that diagnosis.
She's just 10 years old, doctor. I'm worried. Can this be dangerous?
Please do not worry. Your child is in good hands, and we are taking good care of her. And there are complications of surgery, but these are exceptions, not the rule. And usually, patients do recover very, very, very quickly from this operation.
Well, and is there any complications with this operation, doctor?
Yes, like any surgery or invasive procedures, there are complications, but we will try to make sure that we keep to a minimum. Okay. In the early period, the child may have bleeding, but rest assured that he will be in hospital, and we will be keeping an eye on your child. And he will start drinking and eating once his bowel movements are back. That is, he's able to eat and drink. And sometimes the wound can get infected, but even it's very, very uncommon complication. And after months,
the wound be big, doctor?
Usually it's not that big. It's about an inch or two. in uncomplicated surgeries, it's about an inch or two, not more than that. But again, sometimes when it gets complicated, then they need to give a bigger incision and the wound can get bigger. But again, it's an exception of the rule.
And I'm told, doctor, that Mr. Ladd is going to operate on her. Is it true?
Yes, he's our lead consultant and he will do the surgery.
Oh, doctor, he was the same doctor. He was the same surgeon who operated on my husband, and then unfortunately he could not save his life. My husband.
I'm sorry. I'm really sorry to hear about your husband. But may I know what happened to your husband? What was the reason for surgery?
Yeah, they said he had cancer in his colon, in his gut, and then they said he needs surgery. And then after a few days of surgery, he succumbed, doctor.
Yes, I'm so sorry to hear. Again, it must be great loss for you. But you know, there are different surgeries, and the cancer surgeries usually do not carry a good prognosis, because by the time the patient has landed in the hospital, they already have advanced diseases. So if I were in your shoes, I would not. Sorry.
Do we not have another surgeon? Is it necessary that only Mr. Ladd has to do surgery? I mean, on my daughter.
Actually, I think your doubts are not based on facts, and I do not think that it will be necessary for you to worry in this regard, because Mr. Ladd is a very competent surgeon, and as you know, complications can happen in surgery, and it was an unfortunate event in your husband's case that he was having a disease that took his life.
Doctor, is it sure that she has to undergo operation? There's no other way?
Yes, considering the risk of leaving it as such will be very high. And the surgery is a very standard of care in this case. So I would suggest that you go ahead with the surgery, your child. And
doctor, I had a neighbor whose son also was diagnosed with this appendicitis. I think it is the same condition, and she told me that he did not have to undergo any kind of surgery. So why my daughter, doctor?
You know, the patient's condition and presentation at the time of when they come to hospital vary. So the doctors might have decided for your neighbor's child that he may not need surgery, but in your case, it's clearly there is clear danger that if we do not surgery, the infection may spread to the whole tummy, and then she will require a bigger procedure or even further complications.
Can I see her, doctor? Can I see her now?
Yes, you can see your daughter. At present, our nurse is taking care of her, but you can see her. We are going to guide you to her ward, and you can meet your child.
Okay, doctor. Thank you.
Thank you.
All right. Are you done?
Yes,
how were you supposed to end your conversation in this session?
Yeah, we were supposed to summarize the result of this conversation.
And the last your sentence should be that I'll leave my number with the nurse, and in case of this, any help that you need or inquiry out, then you can contact me. But it did not go that way, and time went, and you even took 15 seconds extra. So can you first give Dr. Kama his feedback, please? But I realized even Dr. Kama was not fully prepared with the questions. Because here, mother should be very emotional, feeling guilty. She would be crying. She will be like showing a lot of guilt, and she would be like blaming herself for this condition. And the doctor has to come in, and the exam candidate has to come in and try to relax the mother down, offer her a tissue, offer her a place to sit, maybe a chair, without even physically coming in contact with the mother, but like you have to relax it down. Can you please sit down? Can I offer you a glass of water to calm down? Can I, would you like to have a tissue? And then, okay. Then his question was all right. His question was good. Can I know your name in relation to the child? So yes, then give feedback, please. What happened next? In your opinion, Dr. Karma, how was Dr. Muhammad Ali's performance? He did a big mistake. One, yes.
He tried to address all my questions.
Yes.
Maybe in some of the questions he could be brief, like no need to explain too much.
Yeah, for example, please.
Like for example, when I was asking about the thing about the investigate, I mean whether he's very sure whether any complications, then no need to explain the complications in detail.
Yes,
like just list them.
Here you have to, because what he didn't do, he mentioned infection, but then he said it's nothing to worry about. But then in this scenario, because it's a female patient, female child, and what happens that this infection can lead to severe infection and blockage of the fallopian tubes, right? So that can lead to subfertility. This is one risk factor that he must mention, because yesterday we were discussing one mastectomy case, that why the daughter wanted to take the mother, right? And what was the scenario? Was it like it was mother's decision or daughter's decision, or daughter wanted to take mother to her home or to mother's home? See, so they make it confused. Because they realize the candidates are confused about the statement, they're not aware, so they confuse you. Here, child,
Ma'am, can I interrupt you?
Yes, please.
Yeah. Madam, actually, this subfertility is a complication of appendicitis or a complication of
the procedure.
Of the procedure.
Yeah.
Okay.
Because you operate on the patient, and then after the operation, infection can take place, because you don't know how the appendix would be. Maybe it's like busted. So once you operate, then only you'll know how the position would be. And then this is like if you read the basis notes, you'll know, because and then one more thing asked about the disfiguring. So you answered it very well. It will just leave a little scar. So there'll be very little chance of disfiguring because it's a female child. So, but then this subfertility risk factor that you have to mention is the problem associated with the procedure. Then mother's next question would be, so that means my daughter cannot get pregnant in the future. And your answer should be no. I understand your apprehension, and then there is another healthy tube available. Yes, Dr. Abbas. Yes, please.
Thank you very much, ma'am. Very beautiful contributions from everyone. I just wanted to say that Dr. Muhammad Ali, you might not have to, I don't know, maybe because this is a mock station, but you need to put a lot of energy into your presentation, because honestly, that place is like a war. You want to take it, you want to get your answers, and you want them to hear what you're saying. Some examiners will just be looking at you. They are not scoring you. There's no expression. There's nothing for you to determine whether you're doing well or you're not doing well. They're just looking at you, whether you're doing the right thing or not. They're just there. And then when you leave the place, they score you whatever they like. So I think my humble advice is that you take the exam as if it's a war. You're going to get your points, the maximum points, as much as possible. So you have to put in a lot of life into your presentation, your discussion, especially even at the mock, so that you can get used to it before you go to the exam. Thank you. That's just what I have to say.
Thank you. Thank you.
So this was like my feedback, what I was telling you, like you have to, there are 2, 3, 4 questions on just this subfertility, like discussion. So this would be my request that you go back and read and we'll try again, definitely, with more energy. And I want everyone to come prepared. Like mother should show or give expressions and emotions, and you are there consoling her and calming her down, because this is what will happen in the exam. If this station comes, this is quite like common one, it comes often. So if it comes, then you should all both way be prepared, what to expect from the mother and how to behave. Good. Started your timer, and here is your question.